Hi, my name's Alexis Quinn. I work at the Restraint Reduction Network and Rightful Lives. I'm also an autistic person and was detained under the Mental Health Act for almost 4 years. This video is about the proposed changes to the Mental Health Act bill, which might go through Parliament this November. Dawn, do you want to introduce yourself?
Hi, I'm Dawn Cavanagh. I work at Manchester Met University. I have autism and I have a son called Jack, who's 20, and he has a learning disability, autism, epilepsy and ADHD, and is currently locked up in a PICU.
Thanks, Dawn. And Julie?
Hi, I'm Julie Newcombe, co-founder of Rightful Lives, and more importantly, mum to a wonderful autistic guy who spent time in abusive hospital settings and is now living a great life in the community.
Thanks. So today we're going to focus, I think, on some of the changes to the Act, and notably, the ability of the Act to detain people under Section 3 for treatment when we know that autism and learning disabilities can't be treated. So what I'm really concerned about is I see pretty much daily on Rightful Lives Facebook page and in the Twitter of really concerned parents or guardians whose children have maybe exhibited distress in a way which could be described as, Dawn, what was it called again?
Abnormally aggressive or seriously irresponsible conduct.
So under the Act, you can currently be detained for that. Okay. The other option, if you're not detained under the Act, is that obviously you go down a criminal justice route. And we know that this is happening more and more. For me, certainly in the last year, that was a possibility a couple of times, responded to with criminal justice. But thankfully, people saw the medical need. Now, if we remove autism and learning disability from the Act as a longer term detention, while there is no community provision, let's be honest, there's no community provision at the moment. Nobody's getting support in the community. So it's, how do we want distress responded to? Do we want a criminal justice route or do we want a mental health route? Dawn, I know you feel really strongly about this. What do you?
Well, one thing that I feel very strongly about is the bit where they say you can be detained under Section 3 if you have a learning disability. And then they say if you have abnormally aggressive or seriously irresponsible conduct, and then they go on to say, and it's not attributable to other factors such as physical health or social or emotional need. And that bit I have a real problem with, because they're basically saying that the behaviour has no cause. It's like, how can behaviour have no cause? So basically what you're saying is it's kind of like your fault. So if like Sam's having, he's been absolutely fine and he starts to have difficulties, are we actually saying that this behaviour has just happened? And then
exactly. I think the problem is there's no community support, right? So that bit that you've just read out there about, physical health needs or social health needs, we know that people get distressed for a reason, and usually that's because something's gone wrong in the community.
And we know with austerity and everything that's happened that things are quite dire right now. So if we're not looking at the causes, you're just going to end up just trapped in the system.
Yeah, I mean, I think they call it seriously responsible, behaviour and such. What they're not saying is this is criminal behaviour. So the Act is providing it's acting as a safety net for a lack of community provision, which we know isn't there, and we know there's going to be no investment in it, or it's not going to be enough. Judy, you've got some stats about that, right? Like, it's just not sufficient investment, right?
It certainly isn't sufficient investment. I can't remember the stats off the top of my head, sorry, but what I do worry about is if we're going to take autism and learning disabilities out of the Mental Health Act without putting the right community care in place first, then people will just have either the criminal justice route to wander down, or they'll be homeless out on the streets, nowhere for them to go, because perhaps they'll have been turfed out of their accommodation, or they'll just end up in prison. And it's actually scary to think that people are campaigning to take autism and learning disabilities out of the Act without making sure that the right provision is available in the community first. You have to do that. The other thing that concerns me as well is that irrespective of whether we put the right community care in place first, is that we are already seeing people having their autism diagnosis taken away. and replaced with something else that would fall under the Act, for example, personality disorder, or even schizophrenia, or bipolar disorder. So, or people who are autistic or have a learning disability are being given a comorbid mental health diagnosis, again, to justify their detention under a new Act. So we have to be extremely careful about how we go about this, and there's no point changing the law without making sure that the right community care is in place first.
And we see a lot, don't we? It's like on you know, on Twitter of, you know, autistic people, like, you know, like, I've called up, you know, I'm feeling suicidal, you know, and they've just told me to have a cup of tea. You know, this isn't, we're not talking about people, autistic people that have meltdowns that can go and have cups of tea. We're talking about, like, for me, you know, if I'm distressed, I'm going to go run in the motorway. It's not, it's like you're saying, Dawn, it's not a criminal act, right? It's distress due to a lack of support, like lack of social support. I don't need to be, you know, locked up in a jail.
Well, with Jack's case, it was because he was in the inappropriate place to begin with, and because he'd got a corridor running through his home where he was acting as a thoroughfare, and it was noisy, and he'd got people walking through it all the time.
Yeah, I mean, that's the thing, isn't it? Is it like you said, it's not irresponsible behaviour.
It's a reaction to an appropriate environment.
It's distress. It's distress. How we can call it irresponsible behaviour when we don't really understand it. People aren't making the effort to understand the behaviour and to support the person. They're just locking them up.
And often it's when that distress, isn't it, you know, gets to the stage where it's a danger to the person or it's a danger to others. That's when, or it's perceived in that way, or like for Jack, Dawn, right? I mean, they just didn't want him in the place, right? Is that right?
I think it's just the environment was just wrong, and it just got worse and worse, particularly after COVID, with the agency staff numbers going up, and also more and more people came and lived in the place as well. So it just became a much more noisier and busier environment. But I always say to people, how would you like it if people kept walking through your living room all day and slamming doors as they went in and out? You know, you'd soon find that you couldn't manage it very well.
Any of us would react to that.
And when the distress gets like that, you know, we just have to be careful, because, you know, it's either going to be a criminal justice route if it has to be responded to immediately because there's an immediate threat to self or others. It's either going to be a criminal justice route because autism and learning disability are a diagnosis of exclusion, or it's going to be a mental health route. And I, for one, don't think I could cope for 5 minutes in a prison. I might know when the prison sentence is going to end, but you don't get phone calls, you don't get visitors like you do in hospital. You know, it's not a, do you know what I mean? It's almost like out of the frying pan into the fire. That's what we're asking for. We're asking for out of the frying pan into the fire. I don't think any of us here want the Act. None of us here agree that learning disability and autism should be in the Mental Health Act as for treatment. But I don't know what you guys think.
No, it certainly shouldn't be in the Mental Health Act for treatment. But it's like you say, we shouldn't even really be having to have a discussion about whether it's the frying pan or whether it's the fire. The fact is, if people who are supposed to be providing the services got on and provided them, then it's almost inevitable that a lot of people, autistic people and people with learning disabilities, just wouldn't end up either in hospital or in prison. They'd just be living, hopefully, good lives in the community. And we wouldn't need to have this discussion.
Dawn, do you want the last word?
Good on.
Dawn, wrap it up for us.
I was just thinking that you'll always get situations where people are in crisis, and you will probably where placements perhaps don't always work. I mean, that might happen too. And I've often wondered where you should have places to go where if it's not, where you can go and kind of almost, what's the word I'm looking for? Get back to some kind of level of normality again before you move on. But it doesn't have to be a hospital, does it? And it doesn't have to be a prison. And I've often wondered why we don't have a facility like that.
That's, yeah.
Crisis pads.
Kind of, yeah.
It's just a place to reset, isn't it?
Yeah, that's the word, Julie. Reset. Yeah. Yeah.
Okay, well, thanks everyone for listening, and I'm sure our next video will be out soon.